welcome to join us in this OpenX science talk. So today we have two speakers. One is Jim and another is Jr-Jiun. They will talk about the interesting scientific update. So if you have any question, you can add in the chat box, or you can ask directly during the Q&A section, which will be immediately after their talk. So we're excited to host this section. Now, let's Jen speak.
Hello, I'm Jean. Thanks for the invitation. Can everyone hear me? Thank you. All right, let me share my screen. Okay, hello everyone. My name is Jean, and today I will be sharing one of our papers published in Tissue Engineering Part A in 2.5 years ago. The title of the paper is Effective Platelet-Rich Plasma on Chondrogenic Differentiation of Adipose and Bone Marrow-Derived Mesenchymal Stem Cells. And this work is done at the University of Pittsburgh Center for Cellular and Molecular Engineering. So a little bit of the background. Cartilage injuries affect more than 10 million people in the United States, and it is one of the top 10 most costly medical conditions as of last year. It's about $80 billion, everything included, all like hospitalizations and stuff. And the symptoms, the major symptoms are limited range of motion or stiffness, mild swelling, and pain. And here's on the bottom right is a picture of the cartilage defect. So current surgical procedures include osteochondral allograft transplantation, microfracture, and matrix-assisted autologous chondrocyte implantation. However, these techniques have challenges. Challenges include donor site mobility, low availability of chondrocytes, and loss of chondrocyte phenotype. So that's how cell-based therapy comes into the picture. So cell-based therapy, specifically in cartilage tissue engineering, have 3 different components. We have the cells, we have the bioactive factors, and biomimetic scaffolds. Let's talk about cells first. So in our study, we are interested in mesenchymal stem cells, MSCs. There are 2 different major sources. One is bone marrow. The procedure is bone marrow is a gold standard cell source, but the procedure for isolation is pretty invasive and painful. Alternatively, we can collect adipose stem cells from adipose tissues. Our tissue of interest is the infrapatellar fat pad right beneath the patella, the kneecap. As you can see on the right-hand side, the number 1 region is the infrapatellar fat pad. So this piece of tissue can be isolated from arthroscopy, and the infrapatellar fat pad derived ASCs exhibit cell surface markers typical of bone marrow MSCs. And these cells possess better chondrogenic potential than subcutaneous ASCs, according to other literature. So that's our cell of interest. About bioactive factors. In our study, we are interested in platelet-rich plasma, or PRP. As many of you may know, platelets play an important role in local secretion of growth factors, coagulation, and recruitment of reparative cells. So here's a picture of the sample, one of the samples after first centrifugation of human whole blood. You'll see 3 different layers. The top is the platelet-poor plasma. The middle layer here is about 1% volume. it's the Buffy code, which contains platelets and white blood cells. And in the bottom, about 45% of the volume is red blood cells. So the isolation of platelet-rich plasma, PRP, is autologous. And because it's autologous, so it's cost effective. And because it's directly from your blood, so it's minimally invasive. So that's why PRP is so attractive. And in fact, a lot of athletes have received PRP injections after injuries. And these athletes reported pain relief and improved joint function. And whether PRP enhances formation of hyaline cartilage remains controversial. Some of the studies have reported improved cartilage repair with PRP treatment. Others have reported no beneficial effect of PRP. So that's why when I joined the lab, I was tasked with this one simple objective: just test the effect of PRP on stem cell chondrogenic differentiation for 21 days. And the 21 days is the typical duration of chondrogenic differentiation. So that's why we have 21 days here. And so specifically, we are interested in using infrapatellar fat-derived AACs, IFP-AACs, and compared to the gold standard bone marrow-derived MSC side by side. But in this study, in this talk, I would just focus on the IFP-AACs. And we also compare the no PRP group as the control to different PRP concentrations for different durations. The questions we were trying to answer include: if PRP is beneficial, what is the optimal condition? And if PRP is not beneficial, how to make it better? And so here's an overview of the methods. It's pretty straightforward in this in vitro study. We have cell culture, and in this study, we use pellet cultures to mimic mesenchymal cell condensation in chondrogenic differentiation during development. And right after cell pellet cultures, we perform PCR for gene expression analysis, protein quantification, and histological analysis. So we started with PRP preparation. We purchased human whole blood from the central blood bank, and we isolated our PRP in our laboratory. After the first spin, you see the plasma on the top and then the red blood cells on the bottom. And once we remove the red blood cells on the bottom, we activate the platelets with calcium chloride. And after the second centrifugation, we have the PRP release collected. And in addition to PRP preparation, we also isolated our human IFP-AACs in the laboratory. We perform flow cytometry to look at the surface marker expression. As you can see here, we have bone marrow MSCs, subcutaneous ASCs, and infrapatellar ASCs. And then the quantification on the right-hand side, the y-axis is the surface marker expression. And then the bottom, the x-axis is different surface marker. So IFP-ASCs, the IFP-ASC we isolated, they are indeed negative for hematopoietic markers, including CD31, CD34, and CD45. And they are positive for mesenchymal markers, including CD44, CD73, and 90, and 105. And we also did tri-lineage differentiation of IFP-ASCs to look at their multipotency. They are good. Elsham blue is the staining, typical staining for chondrogenesis, and this one is for osteogenesis, and then also adipogenesis. And then we move on to our actual study. We have IFP-AAC pellets treated with different PRP durations. No PRP group, 1 day, 3 days, 7 days, and 21 days. And then collagen 2 and aggrecan are two chondrogenic genes that we look at in this study. And as you can see, as the PRP duration increased, we see a downregulation of chondrogenic gene expression, collagen 2 and aggrecan. And when we look at the histological analysis, Safrano and Ocean Blue are two standard standing for cartilage matrix deposition. So the more red you see here and the more blue you see here is the more proteoglycan deposition. And then the collagen type 2 is the immunostaining specific for collagen type 2. And as we increase the duration, PRP duration, we see decrease of cartilage-related matrix deposition. And when we quantify this platelet cultures, the glycosaminoglycan normalized to DNA content is in line with the histological analysis. The more PRP, the longer PRP exposure, the less glycosaminoglycan. And then here's a bigger picture. Not only we look at different PRP durations, we also look at different PRP concentration from 1% up to 20%. And everything is compared to the no PRP group in our pellet cultures. As you can see, the more PRP, either in concentrations or durations, the cartilage matrix deposition decreased. And the cell-based therapy, the cartilage tissue engineering, we have 3 different components. Well, I haven't talked about the third component, the biomimetic scaffolds. In our study, we use photocross-linkable gelatin hydrogel. And the key features included cells loaded, we can load the cells before polymerization. We can photocross-link to enhance mechanical properties. And we can use visible light to activate our photooriginator in our gelatin hydrogel mix. And because of visible light exposure, we can change the longer exposure time, the stiffer the hydrogel is. So it's adjustable mechanical property. And we use this hydrogel to look at, to examine the effect of PRP in a translational context. And that's in parallel to our pellet culture. And similar, we have gene expression, protein quantification, and histology as part of our analysis. So very similar to our pellet culture's results, as we increase the PRP concentration, the chondrogenic gene expression, collagen type 2, and aggrecan goes down. And here's our histological analysis. Ocean blue staining also shows similar, the more PRP, the less Ocean blue or collagen matrix deposition. So that's basically it for this in vitro study. As PRP concentration or duration increased, chondrogenic gene expression decreased, and matrix proteoglycan deposition decreased. Our study is not perfect. A few limitations. One, we did not have the nature of the growth factor as cytokine profiles in our PRP preparations preparations some of the studies have shown that the way you prepare PRP and how platelets are activated would affect the growth factor as cytokine profiles. And 2, all the PRP release we mentioned, we used in this study are actually pooled from several donors. So the future studies after this paper, we wanted to investigate the underlying molecular mechanisms, and simultaneously we wanted to proceed to in vivo studies because everything here is in vitro. In fact, we did begin our rabbit study thanks to our orthopedic surgeon, Ben, and our junior faculty, Pete. They are tremendous. They help a lot. And here is a picture of our rabbit adipose stem cells tri-lineage differentiation. We have 6 donor rabbits, and this tri-lineage differentiation assays show that these AACs were able to differentiate to 3 different lineages, including the chondrogenic lineage. And orthopedic surgeon Tomoya would be the lead author on this rabbit manuscript. In this rabbit study, we wanted to look at the repair of osteochondral defects in 60 different rabbits. The total duration of this study is 3 months. We have 6 different groups. We have shunt operation, basically the joint capsule was cut open and closed. We have defect only group, basically the defect was left untreated and closed. We have hydrogel only group, hydrogel plus cells group, hydrogel with PRP, hydrogel plus cells with PRP. Basically, what we saw benefits of combined PRP and adipose stem cells on most measures, with other interventions showing some but not significant benefit compared to the defect-only group. And not only we started our rabbit study, we also obtained a new batch of PRP, human PRP. And this time, we obtained 6 different donors, 3 male, 3 females, and we look at them separately. And we performed the ELISA microarray to look at 41 growth factors and cytokines. As you can see, a lot of different kinds of growth factors and cytokines here on the x-axis, and then the y-axis is the protein concentration in picogram per ml. And if we take a closer look at the bottom here, the concentration up to 20,000 picogram per ml. Here is a heat map of all 6 different donors. It's basically very different between donor and donor. And with this, we started to ask ourselves, okay, can we make PRP better? Is there any specific growth factor that may impair chondrogenic differentiation? And some of the studies have shown an indication of VEGF, vascular endothelial growth factor, in their chondrogenic studies. So we wanted to look at VEGF as well. So we look at the VEGF concentration in our PRP preparations. Basically, the VEGF concentrations range between 0 up to 300 picogram per ml. And when we added exogenous recombinant VEGF into our pellet culture, we saw a downregulation of SAX9 and ergican, these 2 chondrogenic markers. And when we added anti-VEGF to neutralize the PRP effect, we saw this VEGF neutralization rescued the inhibitory effect of PRP. And in addition to our rabbit model, we started a large animal study, goat model. Similar to our rabbits, we wanted to look at the repair of osteochondral defects in these 24 goats. And because these are large animals, so the duration is extended to 6 months. But differently in this study, we only have 4 different groups. Oh, by the way, this study was primarily done by our orthopedic surgeon, Dr. Shinsuke Kihara. So he will be the lead author on this goat manuscript. And so in this study, we have 4 different groups. All groups contain hydrogel and adipose stem cells. The only difference is the HBSS control. In our first group, it's very similar to PBS that everyone used in the laboratory. And then chondrogenic medium, and then PRP, and then the VEGF neutralized PRP. So what we found was VEGF neutralized PRP overcomes the inhibitory effect of PRP on chondrogenesis in vitro. But VEGF neutralized PRP has some trends towards improvement, most likely due to small sample size. And yeah, that's all. I would like to thank everyone at the Center for Cellular and Molecular Engineering. Special thanks to Rocky, Pete, Ben, Tomoya, Shinsuke, Han, Jan, Karen, and all the lab members, and our funding source, DoD A-Firm. Happy to take questions. Thank you.
Yeah, Jen is now a research scientist in London. So she graduated, finished her PhD in Pittsburgh. So now here's some quick question for you. So is a PRP immunogenic? And how would you administrate the PRP to the rabbits and the goats?
Oh, okay. Is PRP immunogenic? Did you mean whether the animals or human, they will have any immune response after receiving PRP?
Yes.
If that's the case, no, there will be no immune response because everything would be autologous. So in our rabbits and in our goats, rabbit A received rabbit A's blood, PRP. And so basically it's autologous, everything. And same for goats. And translational context, we expect to isolate PRP in the operating room from the patient themselves. And the second question.
How would you administrate the PRP to the rabbits and the goats?
Yes, so as I mentioned in the PRP preparation slide, we isolated our PRP in the laboratory. Everything is clean, sterile. So we mix our PRP release with the hydrogel and the cells under the laminar flow hood. So that's how we administer the PRP to the animals. So basically we mix PRP release with the cells and the gel, and then that's in the epidove, which is bring it directly to the animal facility operating room and use pipette to inject to the joint.
This is an interesting talk, Jane. I have one quick question for you.
Sure.
Since you got 6 different human donors to provide the PRP, and you noticed that there's a difference among the variance among the 6 different donors. So how you would finalize or selected one growth factor rather than a couple combination or not others, you to rationalize your research? I mean, this you see from the pictures, it's kind of lots of variance there.
Yes, yeah, that's a valid question. We know that there are all kinds of growth factors and cytokines within our PRP, but we have to start somewhere. And we basically just have to look at all the literature, trying to figure out whether there is one that we can start with. And luckily we found two different papers they used in their study. They had chondrogenic differentiation. They also used stem cells, and both of them show VEGF as a marker. Well, not marker, it's like they look at VEGF and then they found impaired chondrogenic differentiation. And then they also use soluble the VEGF antibody, and then they saw a rescue effect. So that's how we started this first growth factor.
And one more question. So
yes.
When you started the animal model, I think as a doctor is helping you to started the animal model. So, the goat model or even rabbit is a very expensive model, So how you rationalize your dose? I mean, for these things, you were expected to get the exciting or expected results, the growth factor. That's very expensive. I mean, how many preliminary data you have done, try to, recognize the dose? That's sometimes you add it might not be cause, they may cause some effect in vitro, which is cheap, but in vivo and lasts long, and that's very expensive. So can you comment on that dose selection?
Yes. So in our in vitro study, we look at different concentration. We have 1%, 5%, 10%, and 20% volume by volume. And that's a great question. It was a very tricky selection because we only have limited amount of money, limited numbers of animals. So in our animal study, we use 10%. And the reason we use 10% is, so in the operating room, when these athletes or patients receive PRP injections, the amount is about 10% of the synovial fluid volume. So it's like 10% PRP volume by volume to the synovial fluid inside the joint. So that's why we chose 10% instead of other.
So for
dose.
the animal model, you got how long you keep the animals alive?
So for the rabbits, we had animals for 3 months. For goats, we had animals for 6 months.
So the in vitro study, how many days you have for that?
21 days.
How many cells per walls you put there?
Per pellet, it's 200,000 per meal.
Yeah, it's really need to be very lucky to transit this 21 days in vitro study to, like 3 to 6 months. It's very lucky. And apparently I thought from your interesting presentation, that's got good, exciting results, and congratulations.
Thank you.
Okay, so I think you are going to introduce you may transition to the biotech company or something like that. I mean, we wish you good luck, right?
Thank you. Thank you.
Okay, so due to the time limitation, let's move on to the next